Hi, my name is Praf Solanki. I'm a community psychiatric nurse based in Leicester. I work with young offenders, looked after children, um, foster care, and some work with refugees.
Hi, I'm Idil Aden. I'm a student nurse. I'm working with Praf at the moment on a placement. In this scenario, I will be asking a few questions Praf about his work and what he does, this client group. So, who are your client group? Who do you work with?
Like I said, a lot of my work involves around young people who don't access health services or schools or anything traditional. They're really hard to try and reach out to, especially for their health needs. So, like I said, young offenders, refugees, looked after children. Lots of our referrals will come through the criminal justice system or through social workers. It's quite rare we actually get sort of families or the young people themselves.
So it must be quite challenging working with them, as they probably don't trust the system and they don't want to talk to you.
The hardest part is getting to engage with them. So you have to almost put your psychiatric mental health aside and become almost engagement. Engagement can take many forms. Traditionally, a lot of my young people do not want to come to offices, do not want to come to health centres. So you have to be creative in where you're meeting them. So, and also it's really important to be try and be informal initially, but also to try and maintain that professionalism, which is a difficult thing. So you're having to balance the act between the two. And I found that if it becomes too formal very quickly, you will lose a young person.
So is that kind of trust issue then? If you are formal with them really quickly, they won't open up, they won't trust you?
Don't trust it. And a lot of our children that I see, they have PTSD is a very common factor. But it's not just with the PTSD, there's also depression, anxiety, there's other strains. But I know where this video has been going to, there's lots of PTSD. But I find it's, again, with any mental health, it's going to be that the trust is key in terms of engagement. One of the skills that helps me is a lot of my young people, I try and find out as much as I possibly can about them, their history and everything. So I'm going in there. Sometimes people do not want to, they find it difficult to talk, so I'm relaying their history to them. These people that I come across very rarely have someone talk to them about themselves, because they're in the criminal justice system. It's always been a very bureaucratic system for them. And I find if you've taken the time to get to know a young person, they are more receptive.
Yeah, because they will think that you actually care about them. They don't have to tell you. Again, probably what they told somebody else.
And once you have that engagement, then you can go on.
Yeah.
And you can introduce slowly aspects of maybe it's just psychoeducation. Maybe it's just a support. Maybe it's just initially just making sure that they go to their other appointments that they need. So you're there as a port of call.
So what do you consider to be the most important aspect of working with these children?
I think there's two aspects. I think initially, if you can gain the trust, I think, and I won't rush into it thinking it's not a thing where you can establish in 1 or 2 sessions. Sometimes it's taken me 5 or 6 sessions, and 3 of those sessions a young person has not turned up. So it's about trying to keep involved. I know there is a limit, but with a lot of mainstream young people that I see, their parents bring them, they will engage. With these kind of people, I think you need to really allocate some time just for the engagement process. I think the time factor is important initially. Then you've got the middle stage where I think you can do some psychoeducation, not just with the children, but with the parents, with the schools. So if we can get this team around the young person and everyone is aware of the mental health factors.
What's the hardest or most difficult thing you come across when you were working with them?
The most difficult thing that I come across is having support for myself. That's why I think I'm lucky in my team. I have access to psychologists, psychiatrists, fellow nurses, occupational therapists, social workers. I think what is really important, especially with the clientele that you're going to be working with, is you have access to some clinical supervision. Also, having some sort of access to some training materials. If you can read around the mental health, the types of treatment, the types of engagement, the more information that you have, the better it is, the more confident you will feel. When I'm working with a young person and I have some structure, I have a plan, and it's a thought out plan that has come from supervision, it's much more comfortable. I think the young person as well finds it very containing. So you've gone from a therapeutic engagement relation, you've gone from engagement to therapy, and it's been like a seamless transition.
Okay, and also it would be quite emotional provoking working with these people within yourself, isn't it?
And again, I go back to having supervision. Also, what I find is of beneficial, you have your clinical supervision, which I don't know how accessible it is going to be for the NGOs, but also to have peer supervision, to have it in a group format where you are sharing innovations, you're sharing ideas, also sharing some concerns. Because a lot of the issues that the young people come with is very difficult to have them on your mind, that you're not doing enough. But if you can share similar experiences with other people who are working in the same environment, I find that very, very helpful.
What would be the most important aspect for working with? I think I asked you that question already.
I mean, I thought of the aspect. I mean, in terms of time and money, which is an important factor, and what I'm finding out as well, group work. If we can establish a group work and a group work philosophy, and engaging young people, it really is beneficial. And I found incorporating group work and seeing the child on one-to-one, you have less one-to-one sessions, and the message is a lot clearer for the young person. So again, it's very cost effective.
Plus, they will establish some sort of social ground if you use a lot of young people together.
Because you're sharing, young people are sharing as well their experiences, and they don't feel isolated. And again, it takes away the stigma of mental health, and you can come across as just, I'm having some difficulties, you're having the same difficulties, and we're going to share these and come up with solutions in a group format with people that we trust.
What would be the biggest challenge and obstacles for the volunteers you're talking to when they're working with this kind?
I think because the very fact that you are volunteers, there is a lot of a commitment already there. What I think the difficulties you're going to have to find is access to knowledge base, access to evidence-based practice, some papers, also having access to regular supervision. And again, if that can be organised in some way within the peers or by some agency or some professional practices, I think would be helpful. But whatever happens in terms of supervision, engagement, young people, services, I think the most important thing that I find helps me is if the young person, if they trust you. And I think that is the key, is you as a person, that are going to help these people.
So what would be the best way to develop that trust relationship with a young person when you first meet them? And this would be a young person that probably gone through a lot of people let him down. So how would you?
Is to be interested. Is to, when you're with that young person, is to give them 100% of your time, 100% of your plan, of your thinking, and to invest. So I think when you invest in a young person and you will see minute changes, it is very beneficial, and you will see the satisfaction. So I would say is give them total commitment for that hour and a half that you're with them. Prepare, know about them, so they feel interested. So they're the two things as personal qualities, but it should have a blanket of supervision around that, so you get some support.
Okay, I think he answered all of my questions.
Okay.
I don't know how good we'll, but
yeah, I think from a student point of view, what I learned being in this team is that when you were talking to small children, or when you're talking to children who has a lot of problems, trust it's the best one to go and get that child to open up, and you should know your own ability and your own emotional intelligence. And as long as you're aware that you have a personal thought of thinking and that might affect that person, and you're aware of your own self-awareness, will be the most important part of when you're talking to young people, because they pick it up really quickly.
good luck.